This is where we left yesterday. We have seen about streptomycin, its mechanism of action, common adverse effects, and accordingly what are the most problematic one, what are the basic mechanisms, and how some of the adverse effects can be used as a treatment in certain diseases. Let us go for first one in that case, streptomycin. So it is a narrow spectrum, it is having more activity towards gram negative, and one very important is it is active against Mycobacterium tuberculosis, against which very few microorganism antibacterial agents are working. So we have to classify them typically. Therefore Mycobacterium tuberculosis we have to study separately, because very few antibacterial agents are there which can act against it, or there are some agents, example isoniazid, which have no role in other bacterial infection. This is because of the typicalness of Mycobacterium tuberculosis. So streptomycin is nowadays it is one of the important treatment in tuberculosis. It was the first drug to show anti-tubercular activity. Then many drugs they came into. It acts against extracellular bacilli. In tuberculosis we shall see it in detail. They are also active in atypical Mycobacterium, that is Mycobacterium kansasi and Mycobacterium avium. These are responsible for atypical Mycobacterium, which is not typical. Typical is Mycobacterium tuberculosis. The resistance develop very fast when it is used alone, and therefore it is not useful. In plague treatment, the streptomycin or tetracycline were the drug of choices. Tetracycline was rather more important in that. Then there is a disease, that is tularemia, where drug of choice is tetracycline, but yes, alternatively streptomycin can be given. Then brucellosis, in that also this is important drug. So tularemia is a rabbit fever, or it is also called as a deer fly fever or ORS fever. Is caused by the microorganism, that is bacterium Francisella tularensis, which is a gram negative non-motile cocobacillus. Depending on the site of infection, tularemia has 6 characteristics clinical symptoms, that is ulceroglandular, glandular, oropharyngeal, pneumonic, oculoglandular and typhoidal. These are these various kind of symptoms are there, and on that basis it is classified. So in all cases it is a good drug. Then brucellosis is also called as a Banks disease, or also called as a Crimean fever, or also called as a Gibraltar fever, Malta fever, Mediterranean fever, rock fever, or undulant fever. It is highly contagious. It is zoonosis, that is caused by ingestion of unsterilized milk or meat, or particularly if somebody remains in close contact of various pet animals, from that it can be transmitted. It is transmitted from human to human through sexual contact, or from mother to child. It is rare but possible. Brucellas are small gram negative non-motile non-spore forming rod shaped cocobacilli bacteria. They function as a facultative intracellular parasites. Then next is plague, which is a deadly infectious disease. I think around 2000 or 2001 there was a big wave of plague was there, particularly in Surat city of Gujarat. So it is a deadly infectious disease that is caused by Enterobacter Yersinia pestis. Just like nowadays we are facing the problem of corona. In 1920, very big wave was there about plague. Many people died in that. Millions of people rather died, and it was very dangerous at that time. Many people ran away into forest. They stayed away from people, and after that, after everything was over, they came, because at that time no antibiotics were there, no antimicrobial agents were there. Those who might have heard about Vallabhbhai Patel, that he has taken a very hot hot iron rod he used, and he put it on that, because that was only treatment that time it was available. So plague was a deadly, I am telling was because if we use antimicrobial, it can be it can be now treated. So deadly infectious disease, it is caused by Enterobacteria Yersinia pestis. These symptoms of the plague depend on the concerned areas of the infection in each person. There are two types of important one. That is, one is called as a bubonic plague, another is called as pneumonic plague, and third one is there in which septicemia is there. So if it is in lymph node, then we call it as a bubonic. The lymph node will grow, and particularly in arms or in at other places it will be there. In septicemia, it will be in blood vessels and it will produce sepsis in that, and pneumonic, it will be in lungs, and accordingly it is treatable now as if it is detected early. Earlier it was bubonic plague which has made a big problem in people. Then next is this combinations in anti-tubercular treatment. If we see anti-tuberculosis treatment, there are few drugs which are very common. We will not discuss now because we will have to discuss it separately in anti-tubercular drugs whatsoever there. So we will leave it now. We will not go for this. Then next drug is gentamicin. This gentamicin is most commonly used aminoglycoside. It is obtained from Micromonospora purpurea. It has got broader spectrum, but see what is a funny thing is, in all this class only streptomycin has highest activity in tuberculosis. Gentamicin otherwise better agent, but it has no effect in tuberculosis. This is also having synergism with beta-lactam as streptomycin is there. Here also activity decreases in presence of pus. It is usually used combination with penicillin, cephalosporin or fluoroquinolones, and these are with or without, it is used like ampicillin, vacampicillin, etc. So it can be used with this. Then they are usually used in peritoneal dialysis. In topical creams for dressing and eye preparation, it is very common actually. Gentamicin is the most common in that. It is combined with the ticarcillin for pseudomonas. Gentamicin polymethyl acrylate is one of the formulation. It is a new drug delivery system for osteomyelitis. Small acrylic beads are there which are impregnated with gentamicin. Just हाँ बोलो. नाही आज नका, उद्या सकाळीच या. हां आज घरी पण नाही, घरी पण अडचणीचं आहे आणि मी पण अजून कॉलेजला आहे, मला उशीर होणार आहे आणि नंतर काय थोड्या वेळानं परत तुमचं ट्रॅफिक सुरू होऊन जाईल. तर त्याच्यापेक्षा बेस्ट सोल्युशन नाही नाही नका, आज नका जाऊ. आज घरी पण कदाचित हे लोक बाहेर गेले असतील, तिथं मग वॉचमॅनला सांगणार कोण नाही. उद्या सकाळी केव्हा पण या तुम्ही. हो उद्या घरीच राहणार आहे है ना. ओके. So this is a polymethyl methacrylate. This is acrylic beads impregnated with gentamicin are there. They are threaded over surgical wire and implanted in bone cavity, and it is put there for 10 days and then removed along with the wire. So this will remain over there and it will release slowly gentamicin, particularly in this bone infections. Then next is amikacin. It is not mikacin, it is amikacin. You just remember this. The semi-synthetic derivative of kanamycin. It is next to gentamicin for use. The resistance is comparatively less. It has got wide spectrum. It is reserved as an alternative to gentamicin. It causes more hearing loss. There are few drugs like amikacin, vancomycin. Many times they are used as a reserve drug when other antibiotics are not showing good response. Then they are used in that condition. Because so far less resistance is found. They have got wide spectrum. They can after streptomycin they can also use as a anti-tuberculosis treatment. So these are many benefits, but side effects are comparatively more hearing loss or more nephrotoxicity it can cause. These are the problems. So it is used as a reserve only in condition where it is having more utility. So kanamycin is next. It is also highly ototoxic, highly nephrotoxic. It has got narrow spectrum, and it is rarely used now. It is rather, we can say, second line or third line antituberculosis does, because even streptomycin is less used. So it is in very remote situation it is used, is kanamycin. Then next is tobramycin. It is active against Pseudomonas and Proteus vulgaris, but it is reserve alternative to gentamicin, because again, although it is more active, but it has got more adverse effect also. So comparatively, when gentamicin is not useful, gentamicin is failing or resistance is developed, then tobramycin is used in similar class. Then sisomycin, it is obtained from microspora. It is same as a gentamicin. It has greater efficacy against Pseudomonas. Then nitrilmycin is, see here you can see this word nitrilmycin I am using pronunciation, not mycin. Okay, so you just remember semisynthetic derivative of sisomycin is similar to gentamicin but wider spectrum. It is effective in gentamicin resistant cases of Proteus, Pseudomonas, Klebsiella, etc. So that way it is better one, but again it has got little use. Then paramomycin, to treat intestinal amoeboiasis it is used, that although the class is from this aminoglycoside, but it has more action towards amoebiasis, or it is antiprotozoal activity. It is also useful in cryptosporidiosis in immunocompromised or AIDS patient. Then next is spectinomyces. It is used in chlamydia treatment. Chlamydias are again a sort of different class of microbial organisms which are having different set, and therefore spectinomycin can be used along with doxycycline, because many other antibacterials are not working against it. So remember, paramomycin, spectinomycin, although they are having similar structure, their set of use is totally different. Primycin, already I told you, it is very commonly called as a sopramycin. It has got very high adverse effects, and therefore it is not used, but it is used as a ointment in very popular ointment, cream, eye drops, even powder. So it is used in various topical formation, in various wound or eye infection it is used. Then next is neomycin. Again it has got a wide spectrum actum, but it has got very high ototoxicity, high cochlear and nephrotoxicity. Most common use is a topical, that is ointment, eye and ear drop, skin drop. Mostly it is used in combination of polymyxin and bacitracin, and very popular powder is there, that is known as a Nebacel for Neosporin. These are very popular, and many polybiotic cream or polyantibiotic creams are there, in which they are included with this polymyxin, bacitracin and some of the antifungal. So whenever it is any kind of bigger skin infection, in many cases it is used along with antifungal agents. Neomycin, when it is used with polymyxin B, it is used as an irrigant in urinary bladder, that is irrigation. That means it causes the removal of everything in the bladder, so that prevent the bacteria associated use of indwelling catheter. So whenever catheters are put into when patient is hospitalized and for urine catheter is put into urinary bladder, so it is used as an irrigant in urinary bladder. So along with catheter it will be pushed, so that whatsoever catheter is having any, normally 100% they are sterile, but still because of that if anything is there, or catheter is sterile but the genitourinary tract is not sterile, it is exposed to environment, and therefore in that cases this along with catheter it is used, so that it can prevent the infection. Oral neomycin has damaging effect on intestinal villi, and it can cause malabsorption syndrome, because it is affecting the intestinal villi structure, and therefore it has to be used with normally is not used. then damages the colonic flora, and because of that it causes, we already seen the impacts of colonic flora damage, because this causes deficiency of vitamin K, it causes increase in the opportunistic organisms. That why we call it as a super infection. So it is not used systemically, it is used only for preparation of bowel for surgery, or that is single doses, that when somebody has to go for GI tract surgery, then it is given so that these infections are there, or even these colonic bacteria are not there. It is used in hepatic coma or hepatic encephalopathy, where it is too much serious case. In that case it is used, otherwise it has no big role. Then next is cirrhosis. It can, what is the basis into it? So in healthy people what happens is, why it is used in this, we have seen no neomycin is used, so it is not antimicrobial. It is used in hepatic coma or hepatic encephalopathy. So why? What is the basis of it? So in healthy people what happens? See this, how this metabolism takes place. So in liver, from liver, this it is converted into urea, whatsoever nitrogen metabolic products are there. So they are converted by liver into urea. This ammonia is also going into body at various places. If it reaches to brain, then it is normally not allowed, it is not permitted. But if it reaches to brain, then it causes a problem. And because majority of that is metabolized by liver, whatsoever ammonia is produced, maybe from GIT, from urea, in all cases from glutamine, all these metabolites, they produces ammonia. And because of this ammonia, this is converted by liver into urea, and this urea is then coming to kidney and is excreted. Now what will happen is, when this is normal condition, now what has happened is, in case of cirrhosis, this urea, this liver is not working, liver function has deteriorated. So there is chance that this ammonia will come to what, it will go more to brain, that will cause encephalopathy, that will go more towards the skeletal muscles, and because of that it will be more converted into glutamine, and that can be toxic. So this will act on this. The colonic bacteria are producing this ammonia, they are responsible for production of the ammonia. So and this ammonia, if we destroy this colonic bacteria, then this will not produce ammonia. Ammonia is toxic to nervous system, ammonia is converted to urea by liver, but I told you liver is not functioning in liver failure, so it will not occur. Increased ammonia layer will be producing encephalopathy, that is damage to brain. Neomycin suppresses the colonic flora, thus ammonia production is in the colon is reduced. Because of that, ammonia level in the blood is reduced, and the other drug which is used for this purpose is lactulose, and which is quite safer. Lactulose is a drug, it is a sort of what we can say, osmotic this purgative agents, and this will take this ammonia and it will pass it through excretion, it will improve the excretion. So this is how this is lactulose is used, and lactulose is most prominent in that. And next is, yes, it's over. So this is what this about streptomycin. We shall go for all other drugs once we'll go for the next in the next class. But your class is not serious, I suppose. If you are there, you can attend Maurya sir's class if you wish. Already I have given the link and everything. Please join it. All the best.